I know it's hard to hear right now, but there really is some good news. If one is going to be diagnosed with a chronic disease, well, nobody wants to be, but if one is going to be, this isn't such a bad one. And we'll have much more on all of this as we continue to learn about hemochromatosis with Dr. Dawna Gilchrist, who is a clinician teacher at the University of Alberta specializing in genetic disorders.
But you can't transmit hemochromatosis by blood.
So you can't. So you can't give it to me because you gave blood and you have it.
No. No, this is a genetic condition. It's not a virus.
So I only get this from my family? Is that what you're telling me?
Yeah, and you have to inherit an abnormal gene from each of your parents. Not just one, but both. If you have hemochromatosis, the people most at risk in your families are your brothers and sisters, not your kids.
Why not your kids? Oh, because your husband.
Yeah. So let's say that you have hemochromatosis.
Yes, I do. Yeah, no, I don't.
Well, let's just say each of your siblings is at least 25% risk for having hemochromatosis.
Because of my parents.
Yep. Your kids are at 5% risk because your husband has to be a carrier, and the prevalence of carriers in the population's about 10 to 15%.
Well, and the person I'm speaking about, she says that her husband's family is prevalent.
Well,
what are the odds of that?
Well, it's actually fairly high when you think of a carrier frequency of 10 to 15%. It means you've got about a 1 in 9 chance of marrying someone who's a carrier.
Unless you marry an Asian or a person of, say, an African ethnic background. Loosely speaking, Dr. Gilchrist says hemochromatosis is a white person's disease.
People from Northern European backgrounds. About somewhere between 1 in 200 to 1 in 400, so let's say 1 in 300, has the genetic predisposition to store too much iron. How many of those people will actually go on to get problems from it if they're not diagnosed early? I don't know. Nobody really knows.
We're gonna pick on the left arm this time, and if
Back at the University of Alberta Hospital, Rayne is preparing for her phlebotomy. The nurse has the syringe prepared on that little table in front of where Rayne is sitting, and she puts that rubber tubing thing around her arm. Same as they often do when they draw blood.
So, she asked you which arm. Do you get to decide which arm?
well, I keep track of my arms because if I'm doing it every 2 weeks, and I also alternate veins. I have really good veins, and I think, Linda, when you look, you'd probably say I have good veins. I actually have 6 of them that I rotate through. And the idea is that I'm going to have to do this for the rest of my life. Even once I get my levels stabilized, I will have to be a regular blood donor again, and that could be 4 times a year. And that's 4 pricks in those veins, and that means scar tissue builds up. And I want to be able to maintain, the quality of them. I am fortunate, though.
Is everybody this diligent on knowing which vein and which arm they've had done?
A lot of them are, yeah. And they know if they've got good ones or if they've got rotten veins. Or like small veins or difficult to access
Why are you taking your temperature?
Routine on everybody that comes in. We do check their temperature, pulse, blood pressure before and after.
So if this patient were ill or something, would you not do the phlebotomy?
Generally, they're healthy people that come in for the phlebotomies. If they're not feeling well, if they're down with a cold or a flu or something, a lot of them just rebook to a later date.
Yeah. Last time I was here, we were in that big room with all those other people. What is everybody doing in there? You can't speak specifically about patients, but what are all those people?
Every different thing. It's IV antibiotics, IV treatments, transfusions.
It's not all hemochromatosis.
No. It's all everything. Yeah.
Is bloodletting a normal practice of medical science?
Actually, we've got a lot of people. We pretty much do seven a day, Monday through Friday.
Hemochromatosis?
There's a couple of different diseases that we do it for, but between the two, yes. And sometimes we do a couple in the evenings as well, if we get where we don't have enough room for people on days. Yeah.
You're really brave about this stuff because you give blood, but I must imagine that it must be hard for people that you talk to because you're on the society as well. Like, a lot of people can't do needles.
And I had no problem at all. To me, giving blood or getting poked, I have no queasiness. And as I said, I bleed very easily. They have no problem finding a vein. But I also do things right. I exercise. I make sure I eat every morning. I drink a lot of water before I come. These all help in the process, so it makes my phlebotomy easier on me.
So giving blood, some people feel a bit queasy afterwards or they have low energy and stuff. Are you giving that much blood like you would if you were going to the blood services?
I'm giving a full bag of blood. It's exactly the same amount as what I would do if I went to Canadian Blood Services. But for me, now it's every 2 weeks. And when I first started my treatment, it was once a week. So that is a lot, and you have to watch yourself. But I handled it fairly well.
Are you tired after?
I'm usually tired actually the next day. I feel pretty good that afternoon. It seems to be the next day that I usually lag a little bit. Not exhausted, but for me, I'm a high energy person. I go, and I'm very much a morning person. That next morning, I sometimes feel just a little bit less energized.
Rayne has more energy than most people half of her age. If you're just joining us, she's in her mid-40s, early 40s, no children. Rayne has a very busy career with media relations at NATE, and she's always on call. To look at her, Rayne is the picture of health. She does not drink alcohol. She eats well, including stuff like extra fiber in her diet. She eats all those healthy nuts and pumpkin seeds and lots of fish and other things with those omega-3 fatty acids. No cheeseburgers, and no fatty foods that we have come to know that are bad for us. But even some of those good foods are high in iron. What she thought was helping to boost her iron levels, since many women are low, was doing just that, boosting already too high amounts of iron. Well, since her diagnosis, Rayne has learned that she can still eat healthy foods. In fact, her doctor encourages it because they have other health benefits. Her GP says she would rather Rayne have an extra phlebotomy or two than give up her healthy eating habits.
And I've learned a few other things, like if I am having a high iron meal, then I will drink black tea because it has a chelating effect. So it actually draws the iron out. It stops that absorption. You can do you could do the inside or the outside vein, whatever one.
Nurse Linda has Rayne's arm all prepared and is about to insert the needle into her arm.
Yeah.
But not everybody wants to sit here and do this. I mean, this takes a lot of time.
Oh, for sure it's an inconvenience. But I think it's a gift. I really feel so fortunate that this was... I just had to pause because it was going in.
I know, I watched it.
I feel very fortunate that I was diagnosed early. This is a gift to me because I cannot imagine in 10 years to find out that I have had some sort of organ damage or something irreversible and not have known that this was the simple and easy treatment, because it really is easy.
Rayne considers her diagnosis as a gift. And if you've learned anything about her in even our very short interview, you'll know that she leaves no T uncrossed, nor no I undotted. Once she was diagnosed with hemochromatosis, knowing that she inherited the disease from both her mom and dad, she got on the warpath and begged her two brothers to be tested. Now, Rayne and her husband do not have children, and they don't plan on having any, so there is no risk there. But she has hemochromatosis. Even if her brothers don't, they could still carry the gene. And what if, like her father or mother, their spouses do too? One brother is married with 2 children, and Rayne's first concern went out to them.
And it's in Northern European descent. Well, I'm German on both sides, so... it is in my family history. So both of them had to have been carriers. So 1 in 4 chance. We have 3 children. I guess I'm the lucky or unlucky one.
Do you know if you're a carrier? Like, are you, because you have it, you're a carrier?
Oh, for sure I am.
And your husband?
I don't know about Calvin, but we don't have children, so that's not a concern.
But has he been tested? Like, might he be?
Calvin did go get his iron tested, and his